Knock, knock, knock. Hi, I'm Grace. I'm going to be your student nurse today. We're just going to be doing your medication administration. So, just any scheduled medication. Let's do. Can you. Actually, let me wash my hands and we'll put some clothes on. We'll check. Make sure you are who you are. Alright. Can you go ahead and confirm your name and date of birth for me? Looks like Miss Karen Delaney. Date of birth is 8/19/1966. Perfect. And then looks like on your bracelet here it says you're allergic to dairy and meloxicam, but on your allergy sheet it says you're allergic to ciprofloxacin and latex. Which one is correct? That's ciprofloxacin and latex. Alright, then we'll go and take this off and I'll get you a new one, okay? We'll get that updated for you. Like I said, Miss Delaney, today we're just going to be doing your medication administration. So if at any point you have any questions about any of the medications or something looks unfamiliar to you or you just don't know why you're taking it, go ahead and ask and we'll get that clarified, okay? Alright. So I'm just going to go ahead and start. Go and raise you up. And have you sit up for this first part, okay, Miss Delaney? Yeah. Okay. So the first thing I'm going to go ahead and do before we do any of your oral medications, I want to make sure that you can swallow, okay? Yeah. So I'm just going to have you take a sip of water and just go ahead and take a couple sips and swallow. Wonderful. So we've got your lisinopril, okay? This is just gonna help. Or some side effects you might experience is a little bit of change in your BP or your pulse. So we're just gonna monitor for that, okay? You might have a little bit of nausea, cough or dizziness with this. But if that does happen, you just let me know, okay? So here's this. All right, go ahead and swallow. Wonderful. Excellent. Just document. Next thing I'm going to give you is your acetaminophen. Okay, this is just going to help with your fever. It might cause a little bit of nausea. And if you do experience that, you just let me know. I'm just going to have you take that. And then you can have a sip of water to wash that down. I know it tastes kind of bad sometimes. last thing we're going to go ahead and do is the prednisone. This is just your nasal spray. Help with some of those nasal allergies, help you breathe a little bit better. This might make your throat feel a little hoarse, or it might cause just a little bit mild irritation, but other than that, it should be okay. You have any questions for me? Right, I'm gonna have you take a deep breath in and out, and on the next one, just go and inhale in, okay? Ready? In, out, in. Perfect. All right, same thing. In, out, in. Wonderful. All right. Well, that's it for our oral medications. I'm just gonna lay you back down, okay? Get y'all comfortable. We'll go ahead and continue on. So I'm now just going to show all of the injection sites where I can give an injection, and then we'll get the injections. So for an IM injection, so an intramuscular injection, I can you see me? I don't know if you can actually see me. Hold on. Turn this a little bit. Oh! It came out. Well, we'll do our best with this. So for an IM injection, I'm just gonna have to hold this down, okay, Ms. Delaney? For an IM injection, I can give it on the deltoid. So I'm just gonna place my hand on the acromion process, and I can go 3 fingers right there, right into that deltoid muscle. Now with an IM injection, or in the deltoid specifically, I don't want to give more than 1 milliliter of medication. So if it is more than 1 milliliter of medication, I'm gonna need to pick a different site to give my IM injection. Now, the next site that I can do an IM injection on is the vastus lateralis. So I'm going to place my hand onto the greater trochanter up here and on the patella where the knee's at, and then I can give it anywhere in between onto this muscle right here. And the last spot that I can give an IM injection is going to be on the ventrogluteal muscle. So what I'm going to do is I'm going to place my hand onto the greater trochanter, and then I'm going to tilt my hand towards the anterior, actually this way. I'm going to put my pointer finger onto the anterior superior iliac spine, and I have a little V in between my pointer and my middle finger, and I can give it right there into that muscle, as you can see right here. Right. Now, with an IM injection, if I'm going to be giving more than 5 mLs of medication, I need to split it up into 2 different doses, either into the vastus lateralis or into the ventrogluteal. Now, for the next one, we have the subcutaneous injection. That one is typically going to be insulin or heparin, most likely, but I can just give it 2 inches around the umbilical region, or I can give it on the underarm of my patient right here, or the back of the neck. We don't typically use that one. It's usually for allergy testing, but it can be done if need be. With an IM injection, with subcutaneous injection, I'm gonna want to make sure that I clarify where the last injection has been given, especially with insulin, because a lot of times some scar tissue will build up on that belly. So I just want to make sure I don't give it in the same spot repeatedly. And then the last one, I'm gonna show you on this arm because you can see this forearm better. For our TB skin test, I'm just going to place my hand on the inner crease of the elbow and on the wrist, and I can give it in the forearm right here. And then for IV medications, I just need to make sure that there is a patent IV already established, and if there is not one, then I need to start one. Alright, Miss Delaney, you did wonderfully. We're just going to go ahead and continue on. So the first thing that I'm going to give is our insulin. So this is 4 units of regular insulin. I'm going to move this over like this so that way I can reach the sharps container and you can see better. Okay. Now with our insulin, you might feel some effects of either hyper or hypoglycemia. You might get some injection site redness or irritation. With any of that, you just let me know, okay? So with the insulin, I'm using a 28 gauge needle. It's a 1/2 inch. And with this patient, I want to be able to at least pinch at least 2 inches of skin to be able to go in at 90 degrees. If I cannot pinch 2 inches, I'm going to want to go in at 45 degrees. So this patient has plenty of skin, so we can go in at a 90. I'm just going to clean. Let that dry for a second. Alright, Miss Delaney, I'm gonna go and give your insulin. So I'm just gonna do a dart-like motion and inject slowly. And then I'm gonna hold it for 10 seconds. Sharps. And then I just want to monitor my patient, make sure that they don't have any major changes in their blood glucose. That's not good. And I'm going to go and document. Alright. The next type of injection medication that we're going to give is we're going to do your TB skin test. So Ms. Delaney, before I give you this, I just need to confirm that you can come back and get this read within 48 to 72 hours. And you might experience a little bit of some muscle soreness around the area or some injection site irritation. Just let me know if that does happen. And we're gonna go ahead and clean for 30 seconds. Let that dry. Right. Now with the TB skin test, I'm looking for getting a little wheal or like a bleb, just to make sure. So I'm going to insert bevel up. I can go in at a 5 to 15 degree angle. And I have a little bleb. It's kind of hard to see, but it was squirting out, but it's right there. Okay. Next thing that we're going to give is your ampicillin. Okay, Miss Delaney. This is an antibiotic. It might cause a little bit of like nausea, vomiting, might have constipation with it. But hopefully the main goal is to make you feel better. So, I'm using a 22 gauge, 1.5 inch needle. This would be going into the ventrogluteal. It's 2 milliliters of medication, so it's no issue going into the ventrogluteal. We don't need to split up doses. Okay. Go ahead and clean. And then just to confirm, Ms. Delaney, you don't have an allergy to penicillin, do you? No. Perfect. We're gonna let that dry. Okay. So with an IM injection, I'm going to be using the Z-Track method, which just means that I'm going to anchor my skin, pull it taut, and I'm going to dart-like inject. And I'm going to inject this over 10 seconds. I'm going to pull out, remove my hand, gauge the safety. I'm just going to apply a little pressure for a second and then put a Band-Aid on it. Okay. And document. Alright, the last medication you're going to be getting, Ms. Delaney, is labetalol. Now with this one, I'm going to want to check the blood pressure because it's given if blood pressure is over 160. I'm going to want to make sure that it is well within that range. And then I also need to check the apical pulse. I want to make sure, this is a beta blocker, I want to make sure that it's not too low, as it's going to go ahead and bring down that BP and the pulse. So some of the side effects are nausea, dizziness, and headache. So we'll just keep an eye out for those. Alright, the push rate for labetalol is around 2 milligrams per minute. I'm giving 10 milligrams or 2 milliliters, so it would be pushed over 5 minutes for the 2 mLs. I'm gonna go ahead and bring my arm over here so that you can see. So that you can see what I'm doing. There we go. That should be good. Okay. So we have our alcohol. Got a couple flushes. Got our medication. The needle gauge does not matter on this one because we're giving it IV, so intravenously. Right. I'm gonna come this way because this is the way that the IV is facing. What I'm gonna do is place this here. And we're just going to clean that hub. 30 seconds. Alright, so what I'm going to do is attach our flush. I'm going to go and aspirate, make sure that the IV is patent after I unclamp it, which it was already unclamped. Okay, I'm going to go ahead and flush 3 to 4 milliliters in there. Okay, and then I'm going to start my medication. And now I'm just going to flush this, or push this medication. Again, it's 2 milliliters, so I push it over 5 minutes for the sake of this video. I'm not going to push for 5 minutes, but I am going to push very slowly. And now I'm just gonna flush at the same rate that I injected that medication in. And then I'm just going to clamp that extension tubing while it's still under pressure. There we are. Goodness, this one does not want to clamp. There we go. Perfect. And that's it. Now with this medication, I'm going to want to make sure that I'm keeping a close eye on my patient after giving it, especially within that first 10 to 15 minutes. Just to make sure that we don't have any adverse reactions. And just keep a close eye on all of their cardiac functions. Some sharps. Okay, and now I'm just going to document. And within this amount of time, I should have been able to see, if I were to check the temperature again of my patient, that the acetaminophen brought the fever down a little bit. Hopefully, the nasal spray starting to take effect, and our patient is just overall feeling better. I would do another pain assessment. I know my original assessment, my patient was not in any pain, but I'm just going to double check. Miss Delaney, can you go and rate your pain for me on a scale of 0 to 10, 0 being no pain, 10 being the worst pain you've ever felt? And it's still at a 0, so I'd be okay on that front. Okay. Alright, Miss Delaney, we have now finished all of our medication administrations. Do you have any extra questions for me or any concerns about anything that you took? Okay. If you start noticing any of the side effects that we listed before, you just press that call light and you let me know. So I'm going to place our call light here. And if you need anything else at all, you just call me back here and we'll get it taken care of. So I'm going to put her bedside table that is unfortunately full of stuff. to hand hygiene. You have a good rest of your day, Miss Delaney. You just call me if you need anything.